Now I'll call Dr. Next is now, which always follow the same routine with Dr. Fuster presenting on chronological versus biological after heart and brain interaction, which is the first time I would say that we started combining both brain and heart by Dr. Fuster. Fuster received all the medals, all that. He's a physician-in-chief and in charge of our Mount Sinai Fuster Heart. The whole Mount Sinai Heart used to be, until you saw the slide, Mount Sinai Fuster Heart Hospital. The name had been changed to tribute to him for the great work had done for the Mount Sinai, and recently just got the lifetime achievement from the World Heart Federation. Dr. Fuster, thank you very much.
Thank you. Thank you very much. Over the last 10, 15 years, we have been working on health, trying to understand health. And we became recently very interested into the issue of chronological versus biological aging. And here is what I'm going to be presenting today. It's very important what happens to the heart, the vasculature, and the brain earlier in life. And later in life, you will see how important is the biological aging. That depends very much on what happened earlier. Actually, if you look at JACC in the last few weeks, we have a number of articles on chronological versus biological aging, and we have been very involved in this field. I think you will agree that biological age may be a more valuable predictor of morbidity and mortality than a person's chronological age. Well, let's begin to talk about the heart and the vasculature earlier in life. This is a study we began in 2010, the PESA study, of 4,000 individuals followed for a period of 20 years. We follow them every 3 years from every point of view. Here I point out imaging, which is 3D ultrasound of the carotid arteries, the aorta, and the iliofemoral region. This is calcification of the coronary arteries. And then we use PET and MRI to look at the large vasculature in terms of the quality of the lesions that we see with ultrasound. Well, let's see what happened, the 4 main measure findings of these studies. Finding number 1, in the PESA study, the 4,200 people were between age 40 and 55. The disease begins at young age, at age 20. This is all published. The progression is 33% at 6 years. The lesions actually progress, as you can see. And maybe some of them regress, about 10%. Most importantly, a risk factor at younger age, let's say an LDL cholesterol that is 160 at age 40, has much more impact on the vasculature than the same value at age 60 or 70. This is very important. The reactivity of the vascular system is much higher at younger age than in older age. And this is something that is not in the literature. And we have found this in our studies, and it's very critical. Point number 1. Point number 2 is what happens with the risk factors. We talk about progression, and that is earlier age risk factor makes progression to go more rapidly. But what about events later in life? So we got into the cardiac study, 2,000 people between age 20 and 40, and we measured the area between 20 and 40 years of age. Let's say LDL cholesterol, it fluctuates. This is the exposure, triglycerides, blood pressure, smoking. The results were actually very interesting. 30 to 40 years later, cardiovascular events, look, LDL cholesterol in red means that the area that we measure between 20 and 40 was significantly higher than here. Triglycerides, blood pressure. So what we are really saying is that risk factors at young age not only make progression of the disease much more rapidly than later in life, but at the same time, it predicts events later in life. But there's one question that we didn't answer. And this is going to be published very soon, and I feel very proud of this work, I must say. We started this 15 years ago, when we started 3D ultrasound at age 50 to 80. And this is actually the mortality as higher is the burden of disease at age 50 or 55, later, 15 years later. But here's the question. Is progression of disease actually prognosticates events later on? And in this study, we have in those patients that the disease progressed, the cardiovascular mortality was significantly higher. This is the bioimage study. So summarizing, risk factors at younger age are very important in the progression of disease. Risk factors at younger age predict cardiovascular events later in life. Risk factors in terms of progression of disease means cardiovascular events later in life, just the progression of disease in itself. And these finally the guidelines. If you go to guidelines, an LDL cholesterol here is considered normal. Look in color, the subclinical disease. Diabetes, this is pre-diabetes, a lot of subclinical disease. This is insulin resistance, a lot of subclinical disease. What I'm really saying is the guidelines are completely old. Everything happens at younger age in the subclinical, and I presented to you the three variables. It's no issue. Between age 20 and 40, we are really framing what is going to happen later. But there was no technology up until recently that could really address this issue. So this is the study that we are now starting actually in 2 weeks, the pre-cut study, 2,000 individuals at relatively young age. An LDL cholesterol for us is abnormal if it is more than 70 milligrams DL. And it's going to be a randomization of inclisiran subcutaneously twice a year. Young people don't take drugs, so don't take medications, so adherence is important, versus what the guidelines say. And we are going to follow progression of disease. And you say progression of disease doesn't mean events. Excuse me, I just presented this a few minutes ago. These are young people, will not have events, are too young. But we know that progression of disease will predict what happens later on. This is about the heart and the vasculature. Young age is the time to focus the attention. This is actually what we are doing in the brain. We have been working in the last 3 years very significantly. And this is a study between New York and Madrid. And basically the concept was the following. Large vessel disease, as I presented, or risk factors, may affect the microvasculature of the brain. The pathologist told us this. Hypertension is not treated. Intimal hyperplasia of the microvasculature. Can we look at flow with MRI in patients with high risk factor profile? What about the uptake of glucose if the flow is decreased? We look at PET. And what about cognitive dysfunction? If you have risk factors, vasoconstriction or microvascular disease in the brain, low flow, less uptake of glucose, cognitive function is affected. We publish this. The only problem is not the same individuals had the same technologies. So this led us to the study that we started 3 years ago. 1,000 participants, everybody has the same all the technologies to address cognitive dysfunction of the brain. And just to present to you, the data is quite interesting. The first data we are getting is, no question, if you have 3 risk factors, or 2 of them, hypertension not treated, diabetes or hypercholesterolemia, 2 of them, the uptake of glucose of the brain decreases over a period of 6 years. And so the flow of the brain. This is just published in The Lancet. So what I'm really saying to you is that we have a problem. Things begin at young age, but it's not only affecting the heart and the vasculature. The things begin to be in the brain, and you end up with cognitive dysfunction. And I didn't want to go into all the details of what we are doing in the brain, but they are both heart and brain and vasculature absolutely connected. The key is young age. Having said this, let's go later in life. And here we have the same PESA study in which we look at genomics, genetics, omics, and so forth. First of all, I already presented this, the importance of risk factors in subclinical disease. These are the 8 conventional risk factors from the American Heart Association. Very important. This affects the longevity of life. But here's a critical issue, and that is what happens with the biology of the body, not only with the risk factors I mentioned, with the disease that is identified at young age, but even with psychosocial, economic, psychological aspects that I didn't present. And the data is evolving very rapidly and is very exciting. The cells in the body begin to be affected by all these risk factors. It's not just the vasculature. And what has been identified is all these stressors that I just mentioned increase P53, P21, and P16, and there is an arrest in the biology of the cells of the body. And these cells begin to commit suicide, apoptotic phenomena, and they release substances that attract other cells, and the process of biological aging is evolving. This is completely aside of anything I said. This is at the molecular level. If somebody is getting old biologically by all these stressors that affects the cells of the myocardium everywhere. This is a fascinating, and things have evolved so rapidly in the last 3 years that I'd just like to present to you some data. First of all, the bone marrow. Whenever there is a foreign body, cholesterol or COVID, wherever it is, the bone marrow reacts. And the monocytes from this bone marrow go to the place where the foreign body is and takes the foreign body out. This is the story. We did PET in 900 patients, individuals of the PESA study. And we saw in a significant number of them an uptake, or let's say, of activity with PET, which coincided with what we see in the vessel wall with PET and MRI. In yellow is an interaction of the monocytes with the cholesterol. That's what you see. Well, this is very important, what I'm going to be presenting to you, because it's completely new. These are the fatty lesions, fatty streaks of an autopsy, but we see this in vivo with PET and MRI in the large arteries. And the question is, who is the winner? The bone marrow monocyte that gets into the cholesterol and takes the cholesterol out, or the cholesterol is so significant in terms of quantification that actually the cell gives up and commits suicide, the monocytes. Well, the situation is compensated if risk factors are taken care of, and this cholesterol is taken by the monocytes, and you end up by MRI with a fibrotic lesion with calcification. We have all this quantified, and that is we did MRI and PET, and we follow these individuals. We follow every 3 years. So there's a compensation. Now my view of acute coronary syndromes has changed drastically in the last 3 years by studying this. When there is too much LDL in the artery, the monocytes commit suicide. It's a biological phenomenon. And the suicide is not passive. They release cytokines, tissue factor, and metalloproteinases. And we believe, actually, that plaque rupture is because metalloproteinases released from monocytes that are not able to defend us, and they are committing suicide. And tissue factor is the same thing. That is, a defense mechanism fails, and then there is a shower of cytokines that lead to the acute syndrome. But now I'd like to talk about what is critical in biological aging, which is chip, epigenetics, and telomeres. This is chip. We studied in the PESA study everybody in terms of the cells from the bone marrow, the monocytes. And I just want to show you the data. Very simple. 20 to 35% of the healthy adults, age 40 to 55, have the bone marrow cells are not working well. They are mutated. And this is called chip. Many of you know what I'm talking about, the hematopoiesis problem of the bone marrow. And what we have now in the natural history is fascinating. It's going to be published in Nature Medicine in a couple of weeks. Very basically, what you have here are the monocytes that are mutated, and the lesions evolve afterwards. So basically what is happening is the cholesterol keeps accumulating, but there is no defense mechanism. is not working. And this probably explains many of the patients that we see with acute syndromes that they do not have any risk factor. It's because we have not measured CHIP, which is going to be very easily measurable in the next year or two. So that's number one. Number two is epigenetics. And this is actually fascinating. You know what epigenetics is. Many factors, external factors, they do methylation of the DNA. And these actually cells, which may be monocytes, are actually superactive. It's completely the opposite of CHIP. They're hyperactive with methylation. Well, this is the data. We found in the metabolic syndrome, that is diabetes, hypertension, low HDL. Do you see in blue what happened? The bone marrow is hyperactive. We never had a feeling that the risk factors could actually stimulate the bone marrow, and they do. And you know what is happening? Methylation. So obesity and so forth gets into the bone marrow cells and it stimulates them by methylation. And then the process is fascinating. What is happening is more of the risk factors I mentioned of the metabolic syndrome, higher is the acceleration by PET of the bone marrow activating cells. And what this ends up is with an inflammatory problem in the vasculature that is hyperactive. So this is measurable. Methylation is absolutely measurable very easily. And this is, we are talking about biological age. We talk at CHIP, we talk about methylation, and finally, I talk about telomeres. The results of telomeres is very interesting. You know what the telomere is. It's basically the cell gets into a proliferative stage and it loses some material. And this material is the telomere. It gets shorter and shorter. And the concept is, shorter is the telomere, the cells are less active, and this may lead to atherosclerotic disease. To make the long story short, we are not able to document this in our studies, but we document something, that the telomere gets shorter and shorter as we age. And this is a biological phenomenon. This means our vitality and cell proliferative stage diminishes. And actually, this is quite measurable. I don't want to go into the details, but let me tell you what I said in the last few minutes, that we have a biological aging that actually it depends from a number of mechanisms that are stressors that affect the cells in the body. And there are three mechanisms. One is cells may be mutated, CHIP. The second, cells may be methylated, epigenetics. And third is the telomeres get shorter. All of these decreases the vitality of the cells, and we are really talking about biological age. In fact, the way that is being addressed this today is that all these mechanisms that I mentioned, the three I mentioned, there are already trials that are starting in trying to neutralize the apoptotic cell that I mentioned to you and the mechanisms that I'm just describing. This is beginning at the present time. Can we make life longer, independent of the chronological age? It needs to touch into the three aspects that we have been very involved. Let me summarize. I can predict that in the next few years, this is what we are going to be doing. We'll get risk factors, as usual. Maybe in poor countries, we will not draw blood. Obesity in itself and so forth may tell us about cholesterol, diabetes, and so forth. We will look at subclinical disease just in the legs, because the disease begins in the iliofemoral region. By the way, this is going to be automatized this next year. Will be for the public. Very cheap, very economic. So you will have risk factors, and the most important risk factor, which is subclinical disease. And then we will be able to measure, and it's very simple, CHIP, methylation, and telomeres. And basically what we are really talking about here is the biological age. Today you look at frailtiness and so forth. This is very superficial. This is not superficial. These are the molecular mechanisms that actually lead to frailtiness. And this is, to me, is very exciting. And I'm just finishing by telling you that I was very excited about the field in 2018, to the point that I wrote a book about it, and I went back a few days ago. It's all new, what I presented, completely new, exciting molecular basis of biological aging. And look something, the foreword are actually by two sports people. Rafael Nadal wrote the foreword, and Pau Gasol, the basket player. And what they say in the foreword, they say, this book is very nice, very molecular and so forth, but our message is exercise from day number one all your life. That's basically what the book is saying about it, which is a good message anyway. Thank you.